Every day in my clinic, I see the impact of homelessness, precarious housing, being undocumented, living in poverty, or being racialized and being Indigenous. This means that I try to keep my patient's social context in mind, which is not just about knowing the right questions to ask, but also knowing what to do with the answers. So I try to complete forms, I try to advocate for patients, write letters, but I also realize that while I know the social determinants of health, sometimes politics is the #1 determinant of health. So I became an upstream doctor because I realized that I could use my privilege as a physician to fight for decent wages, good jobs, affordable housing, and access to healthcare for the uninsured, and that would have more of an impact on my patient's health than anything I could ever do in the clinic.
En 2015, j'en étais à ma 3e année de pratique et c'est venu d'un sentiment d'insatisfaction face à l'allongement toujours constant des temps d'attente dans ma salle d'urgence. Et bien que je m'intéresse beaucoup à l'efficience, c'est-à-dire comment est-ce qu'on peut faire pour voir plus de patients par heure, j'en suis venu à la conclusion que probablement la meilleure façon de diminuer les temps d'attente dans ma salle d'urgence, c'est en fait de diminuer la quantité de gens qui consultent à mon urgence. Et c'est alors que quelqu'un m'a suggéré une excellente lecture, celle de A Healthy Society de Ryan Miley. Et depuis ce temps-là, bien, je suis un médecin qui s'intéresse aux déterminants sociaux de la santé parce que c'est clairement la solution pour diminuer l'achalandage à l'urgence.
I decided to become a physician because I wanted to enable my patients to be healthy so that they could achieve their goals the way that I had. For me, it was easy to become an upstream thinker when I realized that what enabled me to be healthy wasn't necessarily access to the medical system or to a doctor. Instead, I had access to a lot of the supports that I believe are shared by people like you and I in this room. A loving family, a safe and stable environment to grow up in, access to nutritious food, and a great education, among other things. This is why I believe the message of Upstream Medicine is so important to share. You and I are part of a very fortunate group of people to both understand the mix of factors necessary to build a healthy society and have the platform through which we can raise our voices to make it happen.
In the theory of upstream thinking, the totality, the cumulative effects of the social determinants of health of individual patients or a population is an opportunity to tell a story about what happens when there is a widening disparity gap in Canada. This is what happens when we don't have housing. This is what happens when we don't have a guaranteed annual income. This is what happens when we don't have pharmacare. It's by telling these stories, sometimes through a palliative care journey and at the end of life, that we might be able to empower change upstream to improve the health of all Canadians.
The most pressing area of social determinants of health in Canada is indigeneity for me. I'm Métis myself, and much of my advocacy work is focused in on the health of First Nations, Métis, and Inuit people in Canada. And there's still so much work to do in terms of bringing truth and reconciliation to the healthcare system in Canada for Indigenous peoples. Now I'm a pediatric resident and I'm surrounded by our young patients. Therefore, I'm really conscious about a child's and family's social background because it impacts my care for them.
Our role as healthcare providers is not only to be aware of the social determinants of health and to do our best for the individual people who come into our offices and our hospitals and our communities who need support around those social determinants, but also to use the power and the privilege that comes with being a member of our professions to advocate for social justice around those determinants of health more broadly.